Good morning, ladies and gentlemen. I am pleased to be invited among you for the second time to speak in this event, the presentation of the publication European Health Consumer Index. The first time I came as a health minister of my home country in 2013, when Lithuania was in charge of the EU presidency. This time I come as commissioner with a broader perspective and interest, and also a certain curiosity and ambivalence. As you may know, my priorities for health can be summed up in three simple words: promotion, protection, and prevention. Recently, thanks to my young followers on social media, I added an additional P, participation. I encourage and take interest in the views of all the actors, including the NGOs who are participating in the debate on health issues. Indeed, I believe that this index published by your Health Consumer Powerhouse could foster discussions among other stakeholders. And this, despite certain reservations I may have regarding the objectivity and methodology used. Therefore, I am absolutely in favor of such publications because of the stimulating discussions they can produce in the field of health systems performance assessment. As you know, the Commission is also working on a health system performance assessment. I am also here to tell you what we are doing to improve our capacity in this field. Health system performance assessments, of course, I do not need to convince this audience of the importance of health system performance assessment. Comparing or benchmarking with peers can be useful to understand how we work and where we can improve. Comparative studies present advantages. We can learn from each other and from the best practices. However, the assessments does not mean rating or grading member states. In other words, I am not in favor of shaming and blaming. Therefore, the assessment in itself is not our final goal. It is a tool helping us to improve systems. Finally, improving performance only makes a tangible and meaningful difference if it brings a real benefit to the health of citizens. If you see in certain countries how is important access to health care, it shows vote results and other things. Let me take an example. Cutting costs or reducing waiting times are not goals in themselves. They are of little, if any, value if they do not lead to a concrete improvement in the health of the people the system aims to serve. Commissioned action in health assessment performance, health system performance assessment. During my hearing, I committed to work closely with member states to help them improve the efficiency and sustainability of their health systems, so that they can provide all citizens with equitable access to care. As you may know, President Juncker invited me to draw lessons from recent experience in health system performance assessment and build up knowledge which can help make evidence-based policies at national and European level. As you can see, this is not something which came out of the blue. We are not starting from scratch. A reflection process with member states on how to build together expertise on health system performance assessment has been ongoing. As a health minister at the time, I played an active role in this reflection, and in particular during Lithuania's presidency of the European Union. As a result of this reflection, we agreed on some common priorities and principles which can be found in Vilnius Declaration. I invite you to read this interesting document. We also decided to work together, member states and the Commission, to pursue a set of common goals. The first goal was to provide member states with a forum where they could exchange their experiences. present their practices, share success stories, and of course, in some cases, also failures, and learn from each other. The second goal was to support national policymakers by identifying tools and methodologies to improve the assessment of their health systems. In pursuing these goals, we are also cooperating with international organizations established in this field, such as the OECD and the World Health Organization. Let me be clear, when we set up this new form of collaboration with member states, we all agreed that we would not rank or grade health systems according to their performance. Our guiding principle is to learn from each other, not to make lists of bad versus good countries. Let me say a few words about health information. Health information is at the foundation of a good performance assessment. The Commission has, over the years, made considerable efforts to reinforce and ensure the sustainability of actions on health information. So far, data collection supported by the health programs has led to improvements of the methodology of statistics collection, development and harmonization of health indicators, and the preparation of health reports. However, many actions were too scattered. Now we want to take stock of past activities and start a new phase which should provide us with a high-quality comparable data. In parallel, we want to ensure sustainability of data collection, transparency in the development of indicators, and full participation of member states in their selection. Our goal is to establish a genuine European Union health information system serving both policymaking and research. Let me finish with a final word on the publication for which we are here today. Clearly, there are several important and fundamental differences between the approach that we have adopted in the Commission and the approach used to develop your publication, the European Health Consumer Index. Those differences can be found in the method of calculation, the way the data is compared, or the mechanisms related to ranking of sub-disciplines. But it is good that we have these differences. I see this diversity very much as a potential driver of knowledge building. And my services remain very interested in the debate on these topics. We will continue to follow it. We all tackle this area from different angles, resulting in a more lively and productive debates. This type of exercise creates a debate and encourages member states to improve. Thanks a lot.